What is medical staff management? An overview of medical staff and credentialing services management provided by the National Association Medical Staff Services, advancing the delivery of quality health care. Medical staff management works to ensure patient safety, provides credentialing and monitoring services for physicians and allied health professionals, oversees credentialing, privileging, practitioner-provider organizations, and regulatory compliance in the diverse healthcare industry, promotes quality standards for the administrative management of the healthcare professionals, involves confidentiality and legal issues associated with accredited services of healthcare organizations, peer review, and impaired physician issues, and monitors state laws, regulatory guidelines, and healthcare organization accreditation standards. Medical services professionals, MSPs, are individuals charged with the responsibility of ensuring that the hospital and medical staff comply with regulatory and accrediting agencies. MSPs interpret standards and implement change and are the liaisons among the hospital administration, the medical staff organization, and the governing body. Medical services professionals possess the knowledge and skills required to efficiently manage the medical staff office, coordinate medical staff activities, and provide follow-up required of the medical staff. MSPs are experts at credentialing and assist the medical staff in assuring the hospital that only currently competent applicants are recommended for medical staff membership. MSPs are an invaluable resource to the staff and administration in understanding and applying the standards that the medical staff must meet. Most importantly, the work of medical services professionals helps save patients' lives. MSPs help ensure that doctors meet or exceed the qualifications of a licensed physician, have received the appropriate level of training and experience, are competent, and able to provide services in an appropriate manner. Seeing a physician who has not been reviewed and approved by a medical services professional can put patients in danger. It can even cost patients their lives. MSPs help keep fraudulent doctors from seeing patients and keep them from harming people's lives. Michael Swango moved from one hospital to the next, killing 35 patients before he was convicted of murder. Alan Zarkin carved his initials onto a patient's abdomen after performing a C-section. Jeffrey Askenazi, charged with 33 counts of Medicare fraud for performing unnecessary procedures. Gerald Barnes impersonated a physician for 20 years. At least one patient's death was attributed to his lack of abilities to perform the duties of a physician. Dean Faiello impersonated a physician and performed laser procedures that killed one patient. Javant Patel, charged with murder and negligence in 87 patient deaths. Dennis Roark impersonated a surgeon for almost 10 years in Michigan. Harold Shipman murdered 260 patients via opiate injections. David Tremogli impersonated a psychiatrist with hundreds of patients in Philadelphia. Neel Sheth impersonated a physician in an Ohio residency program. When potentially harmful or imposter physicians slip through the system, patients pay the price. So what is credentialing? Credentialing is the process of establishing the qualifications of licensed medical professionals and assessing their background and legitimacy. Hospitals and other healthcare provider organizations perform credentialing through their staff of medical services professionals, with review by the medical staff and/or credentialing committees. Credentialing, which in today's high-tech world usually involves the use of internet-accessible software, includes granting and reviewing specific clinical privileges and medical or allied health staff membership. As part of the process to ensure that a physician meets or exceeds all of the qualifications required to practice medicine, medical services professionals research a physician's background and verifies information with primary sources. For example, an MSP will check board certification, current and previous work history, insurance claims history, medical school and residency, peer references, and many others. As part of the research process, MSPs also verify that everything claimed matches everything that has been verified. In addition to credentialing, medical services professionals oversee the process of privileging or authorizing practitioners to provide specific services to their patients. Hospitals and other healthcare organizations must verify that its licensed or certified healthcare practitioners possess the necessary skills and expertise to manage and treat patients and to perform the medical procedures that are required to perform the authorized services. National Association Medical Staff Services, NAMSS, is celebrating more than 30 years of enhancing the professional development of and recognition for professionals in the medical staff and credentialing services field. NAMSS' vision is to advance a healthcare environment that maximizes the patient experience through the delivery of quality services. NAMSS membership includes medical staff and credentialing services professionals from medical group practices, hospitals, managed care organizations, and credentials verifications organizations. The NAMSS certification programs establish industry standards and serve as a comprehensive measure of knowledge in the field. The Certified Professional in Medical Services Management, CPMSM, and Certified Provider Credentialing Specialist, CPCS, designations identify MSPs who have met an established standard of knowledge and understanding in the field of healthcare credentialing, governance, law, accreditation, and regulatory compliance, which help them advance the delivery of quality healthcare. The Certification Commission of NAMSS assures a comprehensive level of knowledge through certification in the medical services profession and is responsible for establishing policies and procedures that govern certification and recertification programs. NAMSS provides quality education to MSPs, helping them reach their potential and achieve maximum performance throughout their career. Offerings include in-person training, online courses, webinars, certification preparation, educational sessions at the NAMSS annual conference, and study materials and textbooks. For more information about medical staff management, visit NAMSS at www.namss.org.